Well, I was born in Barking and I'm proud of it. I led a very hard life. My parents was poor. I know what poverty is. My health started to deteriorate when I was 6. And one of the jobs I done was an odd carrying, running up and down the ladder all day long. This has put me into the stage where I had to have a hip replacement.
I'm a housewife, been married for 59 years. I've got four children, 9 grandchildren and 17 or 18 great-grandchildren. Yeah, I grew up in Romford from when I was 4 years old. Went through the war, evacuated for about 9 months. I met Ben when I was 16 and we got married when I was 19. A year later, I had my first baby. Yes, well, I was diagnosed with osteoporosis of the 5th vertebrae in 1986. And it sort of progressed, problems with my knees and my joints. I was diagnosed with breast cancer and I had 3 operations. And then in 2012 I had a heart attack and had stents put into my heart. But apart from that, I've tried to carry on just as normal, really, but it hasn't stopped me from doing what we wanted to do.
Everything in 1000 Health, it seems very intimate, if you like to say that, because as you said, if you need any inquiries or anything like that, you get on the phone and you were speaking to somebody straight away. So I think there's so many benefits that I've noticed because I've had quite a bit of treatment. Yeah. The concern of the doctor, the attention she's given me, which has been fantastic, I think, because she spends so much time with you, and the key workers in particular, I think, are very attentive, and you feel very secure, if you like, that somebody's on the end of the phone all the time, and I think they play a good part and make you feel a little bit easier.
Well, I find I'm getting more attention. What can I do for you today, Morrison? Meeting nice people. And I look forward to it. And I fetch my prescriptions in here and I get them the same day. They listen to me.
By just making people feel they are an individual and for somebody to listen, because it does make people feel better within themselves, and I think that's most important when you're getting older.
In my old surgery, they was overloaded with patients, and it was put to me that this establishment would alleviate some of that by taking me on, a person that needs more attention than somebody with a cough or a cold.
The practice that we were with prior to Health 1000 was an excellent service. Being at the one practice for over 40 years, then obviously when we was offered to go on to the Health 1000, we didn't know whether we was doing the right thing or the wrong thing. But since then, though we was with them for the length of time that we was, we now feel that we have made the right decision because of the feedback and everything, the emotions that they've taken on board, and the difference it has made a complete difference to us. That there would be several specialists ready on hand. We could be looked after in our own home if need be. You feel that you're sort of privileged that you've been named.
You put it into the perspective of everything gets old and deteriorates. A car needs oil, and eventually it says enough is enough, and that's it. And you can look after it. Unfortunately, I lost my wife, which I love very dearly. I have a son that cares for me. We have an arrangement. He does the shopping and the cooking, and I do the cleaning and the laundry and everything, and maintain the house as much as I can humanly possible. He's a good lad. I wouldn't be without him.
With the key workers and even with the doctors, we can you can get a feeling of more well-being simply for the fact that they've given you a lot more in detail information that you're not really quite sure about. Health 1000, you feel as if they know you personally and they're interested in your welfare. I think that's what it is. Yeah. It's getting the information that you need and them telling you or explaining to you. They will go into details and explain things to you, and if you're not sure of anything, they will sort of go out of their way to sort of really give details and things. You feel that you're getting professional advice, which sometimes you don't always know yourself. You do get that feeling that they are taking on board the emotions that you are perhaps feeling, and they can make you feel a lot better in yourself just by being there, and you know that they're taking an interest.
I love life, and I appreciate it, and you're only given one handful of it, and look after it. But if you keep knocking it, then you're going to blister, Like I said in the first place, they listen to my story, then they work upon it, the knowledge that they was given. Well, it gives me confidence in them, and that plays a big part.
And I think the key workers do play a great part in it, because I think they're the link between you and the service itself. I think that's the main thing. But they seem to ask you questions that probably you don't even think of yourself, and maybe put ideas into your head about different kinds of things. But they seem to get to the bottom of things, or if you've got any kind of inquiries, they will pass it on to whoever is needed. And I think that's a good part of it.
The way that you sort of cope with your own illnesses or your own well-being comes from people that are that are around you, either from a husband or from anybody in the practice who I can phone up at any time. But as I say, when there's a key worker at the end of the phone, it can make you feel so much better in yourself by just giving you like 5-10 minutes on the phone.
Well, I think that there's a lot of difference because having consultants on hand, so to speak, you know, if you need a consultant or a specialist, they're all at hand, they're all in one building, so to speak.
It is easier knowing that you can go there and like they can send you around for a blood test straight away, or they can send you around for an X-ray, or they can get you to see a consultant if need be.